All right, let's take you now back to the Free State, where the Department of Health is embarking on a health road safety campaign targeting taxis, motorists, commuters and trucks at major filling stations where its services can be accessed. The department aims to promote HIV prevention, we understand, healthy sexual lifestyles and inculcate responsible behaviour and HIV/AIDS testing. In addition, condoms and other essentials will be distributed inside a fully operational clinic donated by USAID at the Shell Ultra City in one pit stop in Bloemfontein. Let's now speak to our reporter Makgala Masiteng. Makgala, of course, we spoke to you a little bit earlier on, giving us a sense of what the road safety campaign is all about. I understand that you are in fact joined by the Premier of the Free State.
Yes, Unati, actually I'm just joined by the MEC of Health, Munyatso Mahlatsi. Of course, is the one leading this campaign here in the Free State. I'd like to bring him on just to talk about what is it that they want to achieve with all of these activities that I see here. I see there are various stakeholders as well.
Yes, thank you very much. Indeed, the National Department of Health, the Provincial Department of Health, as well as a number of partners are here to give impetus to this campaign that we are launching today.
What kind of services are being offered here? And I'm also curious about how you're going to get people to come this side, because I can see that it's busy here, but I haven't really seen people coming here to access this kind of services that we have set up here.
Yes, we're going to have a quick briefing session now, and immediately thereafter we'll go on the other side, get to talk to the travelers and encourage them to come this side. But quite a number of services that we provide here, we're trying to make the travelers aware that many of them they can access online even whilst traveling. We now even have an app which has been introduced by one of our partners, which one can just dial a specific number, and they can be able to screen themselves whether they have TB or not. So we encouraging the travelers who go through the province to make use of those online services so that we don't waste their time.
Talk to us about the significance of having the Department of Health being part of the road safety campaign. I've seen you even in the previous roadblocks that we've seen in various roads here in the province. What is it? What's the significance of having the Department of Health there? What is it that you are? What message are you sending?
Thank you very much for that important question. What we have observed as the Department of Health is that during festive, quite a number of our clients or our patients tend to be under the impression that sickness also goes on vacation. And that is not the case. In many instances during this period of time, our clients will not take their medication properly because it's time when everybody is joyful. And what is also said is that even using protection whilst having sexual intercourse, that also is not observed at all times. So our intention here is to make the travelers aware that even during festive, sickness doesn't go on leave.
Talk to us about, I see there's a mobile clinic. Actually, it reminds me of the issue that we have had here in the province of COVID workers that their contracts were terminated or came to an end. Talk to us about that.
Yes, that is true. We do have full services of a mobile clinic on the other side. There may be travelers who may be running short of their chronic medication, and with the proper script and everything will be able to do that. And that's the other thing that we encourage our clients to do, that even when you go on leave, take your clinic card along, or at least take a container, a marked container of your medication, so that we can then be able to assist. Yes, we provide in those services, and our intention is that none of our clients, when they come back from leave, they would find out that they have backslided in terms of us and them dealing with the illnesses that they are confronting.
Talk to us about in terms of the issue that I was bringing up of the COVID workers whose contracts came to an end. How far are you with that, and how were they assisting, or how are they assisting in the department, especially in terms of the shortage?
Thank you very much. We, as the Department of Health, we had to let go about 1,200 workers because we did not have money to pay their salaries. And let me also explain that we did not terminate the contracts. The contracts came to an end and we couldn't renew because there was no funding available. But Treasury has been able to give us some funding in order to carry us to the next financial year, because COVID funding comes as a conditional grant that comes from national government, and we can only be able to appoint against the grant. So if the grant is depleted, we cannot be able to appoint. So at this point in time, we do have funding that will bridge us from January up to the end of the financial year, and then in the coming financial year, we do have a guarantee from national that in the next financial year we'll receive a COVID grant. So we would give those workers about a 12-month contract, and they will assist us a lot in the service point, because all of them are deployed to the front line of our services where our clients are being assisted. And I must indicate that we've had it very rough since we had to release them because of the current shortages of staff that are informed by the economic conditions, as well as the revenue that the state is able to put together, and also be able to allocate for social services, including health.
Just lastly, this service that we are seeing here, is it only here, or there are other filling stations that have a similar thing?
There are filling stations and there are areas where we do have clinics that are situated there to make sure that travelers access these services. But we have not come to a stage where all garages and all service stations have been put at that level, in as much as we would wish to be at that level. So at this point in time, we are here, and this is where we just want to raise awareness that these are the services that we provide.
Thank you very much. That is the MEC of Health here in the Free State, Mnyadzo Mahlatsi, talking about some of the services that they are providing. Of course, he did indicate that, and also appealing to motorists to make sure that they still take care of their health even when they are going on vacation during this festive season. Of course, those services are available here if you are passing on the N1 here in the Free State, Unati.
Makgala Masiteng, thank you so much for that out in Bloemfontein for us.